Alrighty. So just a quick motivation here. The Council of Economic Advisors, we'll talk about it if people aren't familiar with it, but it's a government agency that exists to give economic advice to the president and the president's staff. I think it's pretty unique in terms of what it is and its organizational structure. I mean, Philip and I were talking about it. It doesn't really seem to exist really, but in any other country. It's really an academic think tank inside the White House. And I think when Philip asked me to give this talk, he talked a lot. I guess he wrote this op-ed a while ago about, the Council of Economic Advisors and, whether that might work in other countries, sort of its unique presence and role in the United States. So I'll try to talk about two questions. First, what is the Council of Economic Advisors? And, we all know government has a lot of economists. So really, what is the CA add and why is it useful? All right, so, talk about it real quick here. So what's the Council of Economic Advisors? It's a federal agency within a broader large federal agency. So the larger federal agency is the Executive Office of the President. And just talk about that real quick. The Executive Office of the President is all the agencies that directly support the work of the President of the United States. It's led by the President's Chief of Staff. And that includes the Council of Economic Advisors. Includes a lot of other things. If you all were Americans, you'd probably be familiar with these. I mean, some of these you may have heard of, like the Office of Management and Budget. I think that tends to be an agency a lot of people have heard of. The Office of the U.S. Trade Representative, National Security Council, I guess that's in the movie, so you'll heard of that, right? So those are all, again, constituents of the Executive Office of the President. The White House office is, that's kind of, we're all sort of, I would say anyone you've heard of in the news on the President's staff is part of sort of that individual agency. There's people like on the National Economic Council, Domestic Policy Council, and a lot of people you have heard, like I guess for President Biden, Anita Dunn, I think would be, she's a senior advisor, and so she would be part of that office. And so, it was this, we'll talk about it a little more, but it was established by the Employment Act in 1946 by President Truman. It consists of, the leader is the chairman, chairwoman. So when Biden first took office, the leader was the first chairwoman. I think it was the first woman that ever led, Cynthia Rouse, right? Or she said Cynthia, or I don't forget, Princeton, right? And so that person, the chairman or chairwoman, leads the agency. When I was there, it was Thomas Phillipson. And that person leads the agency, so obviously administratively runs it, but also the external face of the agency in terms of media and big meetings. So, for example, where that really comes into play, so that person's on TV a lot. Whenever the employment reports get released or unemployment gets released, right, or GDP figures come out. So that person almost always is going to be on the news shows, right, talking about and presenting those numbers. If they're good, that's an easy. If they're bad, it's a little harder. But always, obviously, since you are representing the administration, always representing those numbers and trying to present the administration side of things. And then under the chairman are two members, and usually chief economists, and they provide leadership and guidance. And they're almost always academics on lead. Senior economists, so that's what I was. So then we're under the members, and we provide expertise in our specific areas. So I was the health economist when I was there. There's a person who did like trade. There's a person who did the military. There's a person who did agriculture economics. There's a person who did antitrust. So there's a person who came from the Fed to do help with monetary policy. So all the senior economists are experts in individual areas. Usually they're academics or they're economists sort of on the other government agencies. And then to help support sort of that work is going to be research staff, senior staff economists, and they exist as they're in essence research assistants, right? So they're there to help us with those kinds of tasks. I'll talk about this a little bit, but because a lot of people are academics, there's a lot of the workforce is quite transient. So the only people kind of stick around for a reasonable amount of time, well, even then not that long, maybe the research staff economists, so they're to provide some institutional memory. So for example, all our presentations, our slides, our reports, they all have to be formatted a certain way, right? It isn't a certain book, right? The font and whatever, right? But the template. So they're the ones who take care of all that because I might not use PowerPoint, but, as you can tell, but I barely not use PowerPoint, but they're the ones who really help out with that by allowing some information on how things work. And then there's a chief of staff who really kind of, supervises the research staff economists, takes care of a lot of administrative issues. Really kind of, they're the most political, I think, of all the people here. And so I think they're very helpful because, for example, as economists, we may, understand economics very well. I think what we don't understand so well sometimes is kind of how may policy happen or how kind of the political implications of things we do, right? And so they're there to kind of, say maybe like, let's not release that report because it's not in the bottom line of everything else the administration wants to do, right? Or for example, right, maybe if you did this, that would be better. The administration wants to do this. The chief of staff, I think, really helps us liaise with the other people in the White House and understand politically the things that we're doing. There's a very small permanent staff in the Council of Economic Advisors. When I was there, it was just 3 people. One was an administrator. One was the director of macroeconomic forecasting. So that person is a PhD economist, and that person largely helps the CEA with one of the models. So the CEA helps with a model called the Troika model. It's called the Troika model because 3 government agencies are involved in it. It's the CEA, the Office of Management Budget, and the Department of the Treasury. And that model basically is there to predict GDP growth. US GDP growth. Now, there are a lot of models that predict GDP growth. So why is this Troika model so special? And the reason why it's special is because that's the one that the budget uses. So those predictions of the budget uses, it's sort of interesting because you might think because of that like growth projection would be biased upwards, but I think they do try to do a good job. But that is what that model is, and that's why it has importance. And finally, there's a statistician. Not so much in terms of like doing statistics, because I'm economists here, but the stats are there to help us again with the statistics. So, every month the GDP figures get released, right? Every month unemployment figures get released, and so on and so forth. And so the CEA, we get them actually we would get them. I think they come out on a Friday. We get them Thursday afternoon, right? And so he helps us process all that because right when they're released Friday morning to the public, the administration needs to be ready to go with the story. So that person helped us a lot with that, as well as some other data here for them. All right. So I always found this one interesting when I was there because I read this because like the Council of Economic Advisors, it's like one of these rare government agencies that kind of, and this is the act that created the Council of Economic Advisors has this line, and you can see it's like kind of partisan or not partisan, but it's definitely there's a little bit of ideology in it, right? Because that's promoting free competitive enterprise is kind of sort of at the like it's in this last statute that created it, so it does have that. I just found that interesting. But it's there. So in theory, right, that's what we're about, and that's sort of the remit of the Council of Economic Advisors. So what do we do? I always like to say it's kind of like a lawyer. That's kind of what we were, in the sense that, and a lawyer's job I think is has two parts. The first is internal facing, and that's to provide objective advice and analysis. So we would try to present ideas that we thought were good ideas to other people to help promulgate policy. And then policymakers might come to us to ask us if something's a good idea, so we help them. On the internal facing side of things, I think, we were always trying to be objective and to provide the best advice that we could, even if it wasn't necessarily what someone wanted to hear. Like I said, again, it's the same with the lawyer, right? You want your lawyer to tell you their best opinion of your case, even if it's really weak, and that's what our job was there. Now then, there's an external facing side, and there are clearly like we're there to support the administration's agenda. I like this. Lawyers are supposed to zealously assert the client's position under the rules, and I think that was our position too. Is that we're there as much as possible to support and advance the administration's agenda, sort of under like good practices of economics, right? And then so ways we do that, again, media. So most of that again would be either the chair or the members of peer media. And so sort of the job of the staff is to help them, right? Make it good. Again, sort of what are the numbers you need to know and brief them before media. And then also reports. So the only thing the council has to do really, that's again in the statute, is the annual economic report of the president. So we'll present that, and that's sort of year in review, I guess, from an economic perspective. And again, that report is always going to, it doesn't matter if it was 1930s and the Great Depression, right? I mean, that report is always, again, going to, give the administration's view and be supportive and talk about sort of successes and things like that, right? There are smaller reports we'll do through the year to highlight things the administration is doing. or to sort of support or advocate for things the administration wants to do. And then we also have a blog, and so we post things to the blog. So that's sort of the external basic side of things. Yeah, so just a broad structure and you know how we kind of work with other agencies. So you have the president up at the top, and then you know underneath the president are these people are called principals. It's the other thing they're called. So if they're running one of the you know the big departments, right? That's the secretary who runs the agency. If they're within the executive office of the president, that person carries the title as assistant president. And under them are the deputies. So then you can see kind of just the hierarchy underneath. So you have the chairman, the members, senior economists, and then you have the secretary, deputy secretaries, assistant secretaries, assistants to the presidents, deputies, and special. And you know, one of the reasons why this is important is because I think it's twofold. But the first is that like government's really hierarchical. And so you can only talk to people your level. I used to never really understand why titles matter. I don't really care about them, but I realize in government titles are very important because titles dictate who you can talk to. And so as a senior economist, you know, I was kind of informally, you know, considered like an assistant secretary or specialist in the president level. So those are the people I could talk to and what would be a problem, but I couldn't go above. Right. And so, for example, if there was something that, you know, we thought was useful for, you know, an assistant to the president to know, like the head of, like, say, the National Economic Council, so a lot. Like, I'm not even a person. I have to communicate through my chair, right? So it's government is hierarchical like that. Hold on. I'm confused. Alrighty, so I'll talk a little about my time then at the Council of Economic Advisors. So how did I get to be there? I can, you know, honestly, like I've always been in academia my whole life. I hadn't really thought about doing policy at all. But then, you know, one day, this is always my favorite picture. So Thomas Hilton was my PhD advisor. That's my favorite picture of him. And so there's one day Thomas was the advisor. So Kevin Hassett was the chair of the Council of Economic Advisors. He stepped down and Thomas took his place. And, you know, you'll see that was in July. And coincidentally, I happened to be in the DC area about a week after this. And so I hadn't seen Thomas for a while. I emailed him and we had lunch at the White House mess, which I thought would be really casual. And it's not. And yeah, I'll just leave it at that. In terms of dressing and planning how you dress, that's important. But anyhow. A week later, he sent me this email and he said, you know, would you like to come aboard? And I thought long and hard about it. Again, you know, I hadn't been thinking about going into policy. He basically gave me a month to kind of move across the country, which, you know, a little tough. And I just bought a house. And so, you know, it was a bit of a lift. But at the end of the day, you know, we made the decision to go. And so sort of what did I do as a senior economist? So, you know, government's full of these acronyms, SMEs. So that's what I learned. So, you know, I was the subject matter expert in health economics. So what does that mean? So I represent the Council of Economics Advisors view in interdepartmental meetings. And so I'll sort of go back. So, you know, one thing about the presidency is that it's sort of the Supreme Court, if you will, of the executive branch. And what I mean by that is that, you know, there's going to be disagreements, right? I mean, that's true of any sort of government, right? Like, you know, Treasury may want on any issue, maybe Treasury feels a certain way, but you know, here I guess it'd be the health ministry or whatever, right? So people are going to feel right, and then you have the views of the president or the prime minister, right? And so how do these get resolved? And so again, it's sort of this, you know, just like sort of, you know, in law when there are disagreements, you start with lower courts and progressively work your way up. That's kind of the same thing way things here work as well. So again, when big things come up, you know, it starts at this level, right? My level. And so, you know, you have meetings with assistant secretaries and special assistant presidents, and ideally you work out a unified approach on things, right? And then that is the view of the presidency. And so, you know, my job was at these kinds of meetings to represent the view and to try to kind of, at those meetings, and hopefully the issue gets resolved there. If it doesn't work there, then it gets kicked up, you know, to the next, you know, level, if you will, just the deputies, the member, the deputy secretary. And then if it can't resolve there, then the principals might meet to hash over it. And if that doesn't work, then you finally, all the principals will have a meeting with the president, right? And so that's just kind of how, and that's when you make a final decision. So, so my role was at these sort of hopefully at these earlier meetings to kind of represent our views. Yeah. The other thing to do was to brief the chair and the members as appropriate. So any meeting I would have participated in, I would have briefed them about the meeting happened and what happened. And for all the meetings that they would participate in, I would brief them. So for example, when there was a monthly meeting for all the health principals. So, part of what I was going to do was figure out what was on the agenda of that meeting. And I was going to brief Thomas and let him know that we kind of work together, so you come in prepared to know sort of what are the things he wanted to say, what ideas he wanted to present and discuss at the meeting. The biggest meetings we would present, in the biggest meetings, and a couple times again, is any meeting from the president. So again, if there are things that are, a lot of disagreements, sort of the highest things, right? But for the president, and there, like Thomas would have about 5 minutes to really present the view of the CEA, right? So not even 5 minutes necessarily. And so our job is for briefing for that, and really work with him on what are you going to say in a couple of minutes, maybe a couple of slides, couple of minutes, how can you get the message across? So that was sort of one of the most challenging things I think we had to do. I always realized that the president is busy. And so just you have to think through, like, if there was an hour meeting on a topic, that's a lot of time, right? Out of all the things the president has to do, and that's why these are short. Again, you really have to prepare your principal well to present, to really present, kind of what we think is the right way to do, right, and to advocate. As the senior economist, I was sort of taking a lead role for relevant communications. So sometimes I'm working by myself with help from the staff economists. Sometimes I work as part of a team of senior economists, and then sometimes again, it's particularly for the economic board of the president, I have to work as part of the entire CA. But one of the interesting things about the Council of Economic Advisors is that the role is nonpartisan. The senior economists were not political appointees. So a couple of things. First of all, we have limited ability to interact with lobbyists. The other thing too is that we can't really help with campaigning, so that's important, and that would always come up with some of the work that we did. So for example, because again, when I was there in 2018, 2019, so right before 2019, so right before campaign time. Right? So for example, at the time, she was a candidate, Elizabeth Warren, she had a lot of ideas and policy. So we had to be very careful, right? Because, we couldn't really say, like, Elizabeth, we couldn't really, for example, if we wanted to write something, or we couldn't really criticize something that candidate said, right? Like that would not, right? Because we can't help with campaigning. Now we could talk about something that Senator Warren did, or that the Senate Democrats, for example, in general wanted to do, like that we are allowed to advocate for administration against other branches, but we had to be very careful that nothing was sort of directed against the campaign or promoting the president's campaign. So it is a nonpartisan policy. So we'll talk a little bit more. Like me, most of the senior economists are drawn from academia, think tanks, or other federal agencies. I would say the CA they really like people from other federal agencies because they're free. They're just on loan. And so the CEA, I think it may be an irony, but the president's staff is actually quite poor. Most of the money federal government is going to the agencies and not to the president's staff. So if you can save money, yes, that's great. So so we had a lot of people from other federal agencies because they were free. If they're from academia or think tank, I think this is sort of interesting structure. Basically I had two options. One option is I could formally go on leave from Stanford and, without pay, and just be hired and paid by the Council of Economic Advisors. So that was one option that was offered to me. The other option that was offered to me is basically they said the money that they would have paid me, they could give it to my institution, right? And then, it's probably a little bit less than my normal salary, but if my institution wanted to support the rest, then that was fine. So that's in essence a research grant, right? So a lot of NIH funds, as I mentioned, NIH funds most of my time. There's a salary cap on NIH funds, so my institution ends up subsidizing a lot of my salary beyond what NIH gives anyways. So yeah, they were fine. So my chair was very generous when we do that. But most academics at the CA, that's how they show up. So actually, they're on leave and yet not really on leave. So one of the nice things about not going on leave was that I was still able to take care of patients, for example, at Stanford, because I would do that so once while I'm back just to keep my skills fresh. Because if I had left Stanford formally, I would have been able to. I would have had to give up the hospital privileges. Yeah, so when I think about my time in academic medicine versus CEA, sort of what are the things that were similar and different? Fast paced. Yeah, so life at the Council of Economics was quite fast paced. I was there during the height of the pandemic, so I would say then it was extremely fast paced. Sometimes I was asked to do things, and sort of we need this in the next couple hours. Okay, that seldom happens on the patient side of things. So yeah, definitely much faster paced. I would say, yeah, I mean, at the, the work hours were about comparable, except during the pandemic, right? During the pandemic, I was working. It's like I was a registrar, registered all back all over again. So that was tough. Hierarchy. The academic. I know like most of academics is not terribly hierarchical. And a lot of people like academics because of the autonomy. I would say within academic medicine, though, there's a bit more hierarchy. CA, as I just mentioned, is extremely hierarchical. Titles really matter. Like for example, in my dating mail, the chairman of the surgery department, I call her Mary, right? So like, yeah, right. Government is very hierarchical. Can't do that. I would call Alex Azar. I wouldn't call him Alex in sort of professional setting. One thing that's true for both, I think, is the lifeblood, what goes on is the cadre of young junior people who are working really hard, right? So, I would say that was true of both. It really amazed me when I was there how, a lot of the sort of grunt work from the White House at the CA is done by, people who are really young, like 20-year-olds. Like 30 was old, amongst all the staff, and that's across the entire White House staff. Like 30 was old. That was like most of the staffers are 20s, out of law school, just out of law school. You got to find people who can, have the energy to work real hard. Maybe don't care about making too much money at that point in their life. So that's the lifeblood in both cases. It's one of the nice things I like over in the CA was very social. Like I was in meetings a lot. I don't know that I like being in a lot of meetings, but at least it's very social and it was much more interactive. I would say my normal life is fairly an academic setting is pretty not social. I mean, kind of the provision of anesthesia in general is like I'm by myself. And I don't know. I know like there are different models on the economic side of things, but for me personally, it's generally just me working on my own projects or with the research assistants. Obviously, people go into academics because they want autonomy to do things they want to do. Kind of by definition, when you're at the CA, that's completely not true. Someone who's not because of interest in you, because of its interest in administration, right? So far less autonomy. One of the interesting things about the CA is that it is completely transient. I mean, most academics, and this is particularly true of the council, because they are academics, most institutions only let you go on leave for 2 years, right? And so, the CA was an extremely transient workplace. And I thought that was really interesting because I've never kind of experienced that before. But every month I was saying goodbye to someone, saying hello to someone, right? Because just people are on for 1 year stints at a time. So people are coming and going all the time. Whereas I would say in general, on the academic side of things, I mean, when it comes to clinical care, every year we say goodbye and hello to, I guess, new professor residents. So that's true. But other than that, right, in general academics is not a terribly transient workforce. See it really people just came and go. That's just the way it was. But my daily life, a lot of times consumed in meetings. Again, that's not, everyone's different, I know, in academia, but that's not my current life. But a lot of my lifetime was consumed in meetings. I would say greater than half the day was in meetings. So just a lot of in-person meetings to talk about things, resolve issues. So I thought that was new. A lot of time was spent emailing. Maybe y'all are a lot laughing, but again, that's not too much. And then the remaining time, was split balancing sort of the work. So, and I guess this would be familiar, but, you're spending time working on your longer term projects. So the longest term is the economic report of the president, right? So that's, again, every year it has to be there by a specific day. I mean, that's kind of the statute that needs to be done by. So, that the schedule for that is set a year in advance. And so there are milestones you have to meet. So you're spending some time working on that. Might even run regression once in a while for the longer term projects. Most of the time I wasn't. I found that interesting. Most of the time I was doing sort of literature review, kind of simple back and forth type calculations. But then there's the work on the medium term projects. Again, less likely to involve a regression, more likely some sort of simple model or extrapolation formed by literature review. And then, usually for those, you get a month to a few months to get that. And then shorter term stuff really are things that come on the fly. I mean, something's happened in the news, or somebody at another agency wants to work on this, so wants just our opinion, is this a good idea? Or maybe a meeting happens and something comes up and you're like, all right, I'll give you an analysis on that. And I would say that was just coming up all the time, right? Really on the fly. The timeline for that could be hours to days. I mean, again, at the height of the pandemic, sometimes things need to be done in several hours. And so one of the things I found myself learning is asking everyone, when do you realistically need this by? That was a question I would ask a lot. And the reason why is because, I started realizing this when I left, but, we're all economists, understand, trade-offs. So if you think there's some trade-off between quality and time on a project, right, and this production possibility frontier, most of that time in academia were here. And I thought one of the unique and interesting things about the CA was how I had to really operate all along this entire frontier. And that's why I was always asking people, how much time do I realistically need? Because if you tell me a few hours, the quality you're going to get is that, right? Like I'll honor that, but that's the quality you're going to get, right? So if you can, something that you can wait a couple of days, I can do a far better job for you. And so that was always the kind of thing I was trying to negotiate. And that was one of the skills I just had to pick up, was learning to be flexible, learning to work at different points along this production possibility frontier. Yeah, so that was one of the things that I learned, was just, again, to work as part of the entire frontier there. Other things I learned is how to work better as part of larger teams. Again, I'm pretty solo for a lot of my projects, or if I work with other people, typically, I'm taking a larger role, I guess, and there are people where it's kind of in the middle author role. But here, for various projects, I may be, working with not just the research staff economists, but several other senior economists. Really, all of us, contributing sort of in equal measure. So I guess for me, that was a thing. Really the need to be flexible. In general, my plan for the given day, I just had to realize that whatever I thought I would get done on that day was probably not going to happen. Something probably just come up that required a turnaround, and so I just kind of have to roll with it, and I just have to figure out how to work around things that come. I think one of the things that I think that was really helpful, and continues to be something I work on, is how to communicate to non-specialists. At some level, that's just true in general in academic life, is you're communicating to non-specialists. I mean, the people reviewing your papers, I guess, are the closest to becoming specialists, but especially for grants, right? Your grant will almost certainly be reviewed by someone who's not a specialist in what you're doing. So it's in general a good skill to have. But here, most people who do policy are lawyers or people from legal backgrounds. And so how can you communicate the things to them? You have to be non-technical, you need to sound authoritative. One thing that's very helpful to be comprehensive. One thing I tried to do as much as possible was kind of always anticipate what the other side would say. Again, I guess we all know that's a good thing to do in academics, right? But if you're working in politics, and whatever happens, right? If someone else is going to, on the other side, is going to critique you. So always, thinking, what is the other side going to say? What's our response? And one of the key things is how to be brief, because again, the policy people, in addition to not being economists, they're busy just like you are, and so they're not going to read through a 10-page. They're definitely not going to read your paper in Econometrica, but they're not going to read even like 5 pages, right? Like really, but I tried to keep things as much as possible for other people, like really 1 page max is what I tried to do. Really kind of get the highlights, 1 page, I mentioned earlier, but for example, if I had to brief Thomas for a meeting, like when she's presenting something from the president, like Thomas just has a few slides in 2 minutes to get it across. So again, how can we really hit the highlights and make it convincing? I think that was very useful. As you know, in academics, we tend to move along. All right. Other things I learned is just the importance of how important really the in recent years the executive branch has gotten. So. I don't know. This is sort of, I don't know if you know, but traditionally, the United States government is divided into the legislative branch, right? That's Congress that makes the laws. The executive branch that sort of executes the laws, and that's the president. And that's where I was. And the judicial branch, the Supreme Court, right, interprets the laws. And I realized sort of over time that the executive branch has really sort of crept into the other two and executes and has a lot of, in essence, lawmaking ability and interpretive ability. The reason why is because most laws that's written are kind of at some level sloppy or I don't know, loose, I guess, things. And they basically just give, what the law basically does is it gives the executive branch broad authority to enact certain aim. And so because of that, the executive branch has a lot of authority within that law to sort of issue regulations, which have the force of law. So basically, if you have a law that basically says, well, figure out some way to do X, that means the executive branch has a lot of authority to interpret, what's going on, and also to basically write new law and regulations. So, one example I'll give, this is an awful lot to read, but this is the statute that enabled Medicare. And, this is really broad, right? So basically it gives the Secretary of HHS the authority to impose on hospitals any requirements that the Secretary finds necessary to preserve the health and safety of individuals who furnish services at the hospital. Okay, so it gives the HHS Secretary tremendous power, right? They can impose whatever requirements the HHS Secretary would like to. And, so this is, for example, and so the HHS does so through the Medicare conditions of participation. And, one of the things, for example, again, relative to some research I've done, and some, and also impacts me clinically is sort of, the use of non-physician providers for anesthesia. So in general, a certified registered nurse anesthetist, for example, needs to be supervised by a physician anesthesiologist. But then, President George W. Bush inserted this clause into the regulation. That won't be through all of it, but basically, it's exempted states from that requirement. It exempted that requirement if states met certain requirements. And so that's, again, like on both my research, but also clinically, that's a big deal, right? Saying that nurse anesthetists no longer need to be supervised by being anesthesiologists, like that's a big deal. That was done entirely with regulation. Another example of the use of this clause, as you might remember, and it was extremely controversial when it was done, but there was a requirement when the vaccine came out for COVID, there was a requirement that all healthcare providers be vaccinated, right? And so again, that's this clause that was used as the authority to support that, right? So, where does the president get the authority to sort of say every doctor needs to be vaccinated, right? And this was used, and you may know that was litigated. They didn't win, but that's just to say again to show you though that really the executive branch has a lot of authority to issue regulation. That's one thing I never really appreciated at the time. Some of the things that impacted work, for example, that we did at the Council of Economic Advisors. So there's something called the Institution of Mental Disease Exclusion. So Medicaid, which is the insurer for poor people in the United States, it has a carve out. It does not pay for treatment in any facility that treats mental disease. It will not pay that. That's it. It just says it won't. That's on the state to pay for it. But again, the law gives the secretary, authority to introduce pilot programs that could waive certain Medicare or get around certain Medicaid requirements. So under President Trump, there was a pilot program that allowed states to opt out of that. Then some other requirements. The goal is to give states more flexibility in treating mental illness. And so that's an example again of regulatory authority where even though the law says X, it gives you gives you freedom to get around it. And that's something that the president can do. Another good one is how physicians are paid. There was a law in 2015, macro, that sort of moved Medicare, the insurer for the elderly in the United States, towards a pay for quality model. But again, that law gave the president and the HHS secretary a lot of authority. What is quality, right? How do you measure it? How specifically do you pay for it? Again, that's all examples of regulatory authority. So the only thing I learned is that the executive branch really does a lot. It has a lot of discretion. So why is the CA useful? Because the government has a lot of economists. And so I thought through a couple of reasons why I think it's useful. The first and obvious one is that it's responsible directly to the president, and there are people who work for the president. So I think in academia, we know sometimes when you're sharing resources with other people and someone else owns that resource, it's a little hard to, might be a little hard for you, right? To have that resource work for you, right? But here, like at the CA, we're there, and our first priority is for the president. And so I think that's one reason why we're useful, you know, in a way that say in economics at the Treasury Department might not be. The other thing is that beyond economics, we provide quantitative analysis for the president's staff because we're the only people who really in the entire some level we're the only people in that entire executive office of the president who are like, you know, not allergic to math. And so, for example, things that we were asked to do. You know, at some point there was a discussion of, you know, how to deal with a baby, right? And you know, there's something about banning baby and stuff, and so, you know, we provided some quantitative analysis thinking through what the you know potential pros and cons would be of banning baby. I think one thing unique to CA is it's largely academics, right? As opposed to people who are sort of full-time government economists. I mean, clearly bringing an outside perspective. You know, you might think that people in academia who are really good are probably more expert, you know, maybe someone government who's studied a while. Of course, that doesn't always mean they're good at translating into policy, but at least you may get some experts. I think one of the nice things too about the CAs is the flexibility. Because the only thing we have to do is the economic report of the president, we're basically on call for whatever happens. You know, I think a lot of governments and other departments, they have things they actually have to do. It's kind of hard to get them if something comes up, right, to sort of comment on the thing that comes up or to provide you analysis on that comes up. But, you know, we're functionally there on call to do whatever happens. And so I think that that flexibility is really helpful. And then, you know, I would just say probably in academics, maybe, I don't know, relative to someone who's in government, that we again are more used to this flexibility of assignments and working along the entire production possibility criteria. You know, the limitations of the CA, the biggest one to me is it's a transient workforce. So there's really not much institutional memory or expertise. I mean, just, you know, over the course of 2 years, everyone just rotated out. And so there's that. And then again, we're quite poor, you know. And so then again, one reason why we do a lot of regressions is because we just don't have access to a lot of data. Unless it was a publicly available data set, we couldn't read, right? We just didn't have access to it. And so I think that's one of the limitations to it, just that limited ability to do sort of kind of real primary analysis itself. I mean, I'm not using that term exactly correctly, but you know, most of what I did CA literature review, kind of summarizing what was there in the literature for people. Yeah.